According to a recent study done by the Society for Healthcare Epidemiology of America, healthcare workers who cause accidents to themselves and patients due to fatigue cost their communities almost $1 billion a year. This is a growing concern in American healthcare industry. According to the aforementioned article, it is believed that the majority of work-related accidents go unreported. It is also believed that these accidents do not happen due to undereducation or improper training on the job, but rather that these workers are being worked to fatigue. Today I'm going to show you why workers who are worked to fatigue cause accidental harm to themselves and their patients, why this is a really big deal financially, and why this is a really big deal for everyone. Before I talk about this, I want to talk about my audience analysis. I asked 2 questions, and 1 person answered. The 2 questions I asked were, how common do you think it is for healthcare workers to work overtime during a pay period? And do you think staff get enough sleep? And do you think it would be acceptable for healthcare facilities to mandate their employees for a full 16-hour shift without prior notice? The person I asked, and the person that replied, said that they thought that healthcare workers worked a lot of overtime, but that wasn't necessarily a bad thing. They also thought that doubles, so shifts that are 16 hours in length, should not be scheduled 2 days in a row. And they also thought that 16-hour mandations, which is when an employee is forced to work 16 hours without prior notice, should not happen unless the employee signed a document prior saying that they didn't mind. I'm going to talk to you today about the laws surrounding overtime that workers can take, and what healthcare fatigue is, and why it's happening, and what we can do about it. Everyone starts out as a patient. We walk into the hospital and we assume it's going to be safe and they're going to keep us safe and clean. According to the Society for Healthcare Epidemiology of America, like the article I mentioned earlier, it is estimated that over 800,000 sharps-related accidents happen every year in hospitals. In that same article, it was estimated that if these accidents were kept at bay, $8 million a year would be saved. Why is this such a big deal? Well, at the base level, sharps can cause injury to people, and sharps can transmit infectious diseases, most of which can't be cured, like HIV/AIDS. It was also found that it was 8 times more common for nurses to accidentally inflict injuries upon their patients if they had worked 12 hours or more in a shift, and it was found that it was 4 times more common for a nurse to inflict accidental injury on a patient or herself if she had worked 5 days in a row or more. Right now, the current law stands that in 2003, most medical programs agreed that their medical students should only work 80 hours a week or only 24-hour shifts at a time. After that, the Accreditation Council on Graduate Medical Education, also known as ACGME, took that a step further, and they proposed to 16 states that they take on a voluntary state law, which means that healthcare workers can only work or be scheduled for 40 hours a week, and they can pick up voluntary overtime, but the only overtime that would ever be mandated would be if there was a natural disaster in that area, and the society or the community around them required nursing care that they could not staff normally. Right now, there are 2 kinds of states in America. There are the 16 states who have the voluntary overtime laws, which means, like I said before, employees are allowed to do as they please, and the only overtime that they work is voluntary. There are also the rest of the states, which are mandatory state laws, which means that overtime laws, which means that any healthcare facility employer can mandate their employees up to 16 hours and tell them that they must work that overtime. This does not mean, however, that employers feel that these laws are being followed or abided by them themselves. According to a study conducted by Sung Hoo Bae, a nurse turned into a doctor, published by Nursing Outlook in 2011, 3,370 nurses surveyed, 62% said that they felt extreme pressure to work overtime, either by their bosses or by their peers, saying that they had a duty to their facility. In that same article, it was reported that 50% of the RNs surveyed at that time were already working overtime shifts during that week. So why is this happening? On one hand, nurses' wages are really good. In some places, they're up to $40 an hour. The hours are copious. They can work as many as they want, so they basically can make as much money as they want. It's tempting. On the other hand, nurses are also picking up those shifts due to being mandated to pick up those shifts, and they are becoming fatigued and unhappy. In the article I mentioned earlier, it also said that the more a nurse worked uh, overtime that was mandated in a certain position, the less likely she was to stay in that position. Sometimes nurses wouldn't even stay in positions for more than a year because they were getting fatigued and burnt out. So what exactly is healthcare workers' fatigue? It includes sleep impairment, which is waking up tired or exhausted all the time. It's the use of sleeping pills to help you go to sleep or to help keep you awake. It's also antidepressant usage. According to an article titled Stress at Work and Mental Health Status Among Female Hospital Workers from the British Journal of Industrial Medicine, 1,500 workers were surveyed, and 28% said that they were extremely depressed due to healthcare workers' fatigue, and the same 28% said they were also on antidepressants due to healthcare workers' fatigue. Healthcare workers' fatigue also includes mental load. It's reported that nurses feel more mental load than any other healthcare worker, and they can sometimes take it home with them. This can also, and has also, resulted in car crashes due to scattered brain, cloudy thoughts on the way home and being tired. It means physical load. So it was reported that CNAs felt more physical load. CNAs are nursing assistants who basically do a lot of the grunt work in healthcare facilities. And they felt very physically tired all the time, and that too can get in the way of good healthcare. So here's the solution. According to the article I mentioned earlier by the Society for Healthcare Epidemiology for America, the more regulations a state had on mandatory overtime, the less hours a nurse worked, and the closer her week became to 40 hours a week. That doesn't count the voluntary overtime that some of them were taking. In these states, those nurses were also surveyed and said that they felt less fatigued, they felt happier, and they felt happier about their jobs. If all states implemented this, it would result in nurses staying in their jobs longer and creating a better, more cohesive environment and good patient care. Nurses who stay in their jobs longer create a better team in hospitals. A better team in a hospital means that patient care is more cohesive and communication is better, and people aren't constantly bothering with training new people all the time, so patient care gets better. In conclusion, healthcare workers' fatigue causes hundreds of thousands of dollars a year in injuries in healthcare professionals and patients seeking care. Is expensive and causes healthcare facilities to pour their money into repairing damages done to patients and healthcare workers rather than furthering technologies or new medical advancements. The key to bettering the healthcare industry is to improve the well-being of healthcare professionals that make up the small parts of a whole.